Hello everybody, my name is Dr. Ram Krishnan Nair. I'm a consultant emergency physician. I'm also the Chief Executive Officer of JeevaRaksha Trust. You are here today because you've kindly volunteered to take on the responsibility of looking after patients who are at home after having been diagnosed as COVID positive or have symptoms of COVID infection, even though their test results have come back as negative. As you know, given the scale of pandemic that India is dealing with at the moment, and the fact that 90% of the patients are asymptomatic or mildly symptomatic, keeping these people safely at home ensures that the valuable resources like beds in COVID care centers, oxygen supplies, as well as intensive care unit beds in hospitals can be utilized for the most needy, those patients who have got significant symptoms and are becoming moderately or severely unwell with COVID. So your contribution is very useful in making sure that those who are desperately unwell get the very scarce medical resources and they can get well soon and come back to their families. So thank you for joining us today. We will be going through how to identify a COVID patient's symptoms, how to ask the right questions, and make sure that the patients you are interacting with are safe to be at home. A little bit about JeevaRaksha Trust. The JeevaRaksha Trust was formed in 2019 by Rajiv Gandhi University of Health Sciences, the largest health sciences university in the country, producing more than 40,000 graduate healthcare providers every year, as well as renowned NGO from Mysore in Karnataka, Swami Vivekananda Youth Movement. The aim of the trust was to enhance emergency care education, not only amongst medical and healthcare workers, but also citizen volunteers, because we firmly believe that unless and until the citizens are trained in providing handy, effective healthcare to people who are undergoing emergencies at home, by the roadside, or at workplace, the hospitals won't be successful in bringing those patients back with good quality of health. So to that effect, today I'm very happy and proud that all of you are joining the Citizen Volunteer Army who will be looking after patients directly or indirectly while they're suffering from the COVID pandemic. So let's all come together to volunteer and make a difference in these unprecedented times where we are seeing tragedy evolving all around us and the existing systems not coping to deal with the amount of workload. So we go through to assessment of COVID-19. What is COVID-19? We've heard a lot about it through media, social media, or our neighbors and friends talking about it. It basically means a coronavirus disease which evolved in the year 2019 or 2019. So in shorter version, it is called as COVID-19. It is caused by SARS-CoV-2. That's the technical name of the virus. So what are the symptoms? I'm sure most of you would be aware of it. As you rightly guessed, fever, yes. And the other common symptom is cough. Also, difficulty in breathing is another common symptom which happens with patients who've got COVID-19. The other symptoms are sore throat, body ache, or myalgia is the other technical term used. So especially people who are well built, elderly, they get a lot of body pain. You might feel really, really tired. You may not have the fever, may not have the cough, but you might find that you're extremely tired. That could also be because of COVID-19. Feeling lightheaded or dizzy. Nausea, which is the feeling of wanting to vomit or vomiting itself. And diarrhea or loose stools are also common other symptoms for COVID. So for the first peak, we had what is called anosmia, so not being able to smell and losing taste when you're trying to eat food. That was a common symptom, but in the second peak, we're not finding it as much as we had in the last time. How does the virus spread? Again, you might be aware of this, just revising it. Primarily spreads from person to person via respiratory droplets, from cough or sneeze, or even when somebody speaks quite loudly or laughing out loud, you can spread the virus through what we call the respiratory droplets. It could also potentially spread by touching an object or surface with the virus on it. This then, when you touch your mouth, your eyes, or your nose with the same hands, could transfer the virus onto your face and then inside your body. So this is a lesser probable chance of spreading the virus. The highest probability is if you come into contact with respiratory droplets of an infected person, that is the highest chance of getting the virus. It could also possibly spread through excrement. If toilets are not properly cleaned, that is again a surface from which you could get the virus. It takes approximately 2 to 14 days, but on an average, by about the fifth day, the infected person should be showing some symptoms. People who are showing the most symptoms, so when you're coughing and sneezing a lot, that is when you're highly likely to be spreading the virus. So highly symptomatic, highly infectious. The cycle of transmission, now we said it is spread through the respiratory droplets. So if somebody is sneezing or coughing or laughing out loud or talking very loud, respiratory droplets will get out of their system and will be spreading around the environment near them. Okay. Next, if somebody is standing close by without wearing a mask, without any protection, the droplets could enter the nose, the eyes, or the mouth of those people, and thus the virus get transferred. Also, if somebody is sneezing or coughing, the infected droplets are getting onto their hands and then they touch some surface or a person, and the virus gets transferred across. Okay. How do you prevent? So what kind of safe practices can we do in the community to make sure that the virus is not spread? Again, we are all aware of hand hygiene, so 2 minutes of washing with soap and water. And now the guidance regarding alcohol-based sanitizers have changed. So in the past, we used to say 20 seconds. Now we say you have to wipe the hand thoroughly for 40 seconds after getting a hand sanitizer on the hands. Respiratory hygiene. So the picture on the left side where somebody is sneezing or coughing onto the elbow, this was common. We used to tell our tuberculosis patients to keep their face away from people and cough into the elbow. But now we say, please wear a mask. Even if you're about to cough or sneeze, please don't take the mask off. Keep the droplets inside so that you're not spreading the infection. Social distancing, 2 meters or 6 feet between people. And the vulnerable age group, that is elderly, people who are immunocompromised, little children, all the vulnerable age groups, make sure that you're keeping them within safe surroundings so that the virus is not spread. What are the risk factors? What makes you highly at risk to develop the severe forms of COVID? So they include older age groups, that is people who are above 60 years of age, and the risk goes up as you get older. Also underlying chronic medical conditions. So by this we mean high blood pressure, diabetes, people who have had strokes, people who have heart problems, kidney or liver problems, people who are taking medications like steroids or any chemotherapy for cancer, etc. These are the individuals who are at a very high risk. Severity, people with COVID-19 could have different types of severity. So thankfully, 90% or around about that number of people, so 9 out of 10 get only a mild infection or they don't even have any symptoms at all. Then you've got the group who get moderate set of symptoms. Many get severe symptoms, and there are some who present to us with such high levels of symptoms, the body is already ravaged by the illness, that there is nothing the healthcare fraternity can do to save them. So they present with a fatal illness. So the mild COVID, what are the mild symptoms? So who do you call as mild COVID? So anyone who doesn't have any symptoms at all. So randomly you tested 10 people. Now you know in our state it is 6 out of 10 might be turning positive, but out of which 3 or 4 people have no symptoms at all, no fever, no cough. Those are the asymptomatic cases, but the test shows that they're positive for COVID-19. Then there are people who are symptomatic, which is they have cough or fever or dizziness or pain along their muscles as we discussed earlier, but they don't have any comorbidities. So remember again, comorbidities is diabetes, high blood pressure, heart disease, etc. And then there are people who are symptomatic. They have high blood pressure, diabetes, or stroke or something in the past, but these are controlled. So you are taking medication for your blood pressure, you are taking insulin or tablets for your diabetes, your blood sugar is under control, or you're not getting regular chest pains even though you've had a heart attack in the past. These are all people with controlled comorbidities. So that group also now comes under the mild COVID category. In the last year categorization, people who actually had comorbidities, people who were older in age group, automatically were classified as moderate COVID. So this is one difference that has happened in 2021. So such people, they are safe enough to be isolated at home. Their symptoms need to be monitored twice a day. So what do you look for? You look for temperature every 12 hours as well as the saturation of oxygen in their blood. So this is done by the clip-on device. I'll show you a picture shortly, which is attached to the tip of the finger, which shows how much oxygen is there in the bloodstream. So in mild COVID, what are the red flag signs? So you're calling the household, you're asking the questions, what should make you think that this patient is not safe to be isolated at home? So if they're complaining of increasing breathlessness, if their resting heart rate, so the saturation machine also shows the heart rate of the patient. So if that number is more than 100 when they're resting, remember, if you're exercising, if you're stressed, if you're cooking, climbing stairs, etc., the heart rate could go over 100. So we're looking at the heart rate, for example, when somebody wakes up, when they're completely rested, or they're sitting and watching television and they're watching something which is pleasant, so not like news by Arnab Goswami, in which case if their heart rate is under 100 or the resting heart rate is under 100, we are not worried about the patient. If the saturation when it is measured, if it is 93 or below, so anything below 94 on room air saturation is also considered as a red flag sign. We will be talking about the 6-minute exercise induced exercise test in the next set of slides. So they do their 6 minutes exercise as you advise them every day, and if their saturation is falling by 3 points or if it goes below 94%, again that is a danger sign. If there is any red flag signs, the patient needs to be shifted to a dedicated COVID health center or maybe even a COVID hospital, depends on how bad things are. You don't need to worry about where they're going. All you need to do is highlight these patients to the next set of volunteers, your healthcare volunteers. They will pick up the pieces and make sure that the patient is shifted to the right center. So moderate COVID. So what could be moderate COVID? Moderate COVID is the group of patients who have got some level of lung involvement. They've got what we call pneumonia or lower respiratory tract infection. So there are two types. The ones without respiratory failure will have fever or cough or breathlessness, difficulty in breathing. They could have still saturation which is above 94% in room air, and their respiratory rate could be still below 24 per minute. So this is the moderate COVID group, but they're showing obvious signs of pneumonia. So the fact that the saturation is still above 94 and the respiratory rate is still above 24 tells you that it is mild infection of the lungs. So what is the treatment for these people? If any of these symptoms are there, they should be going to a dedicated COVID health center. So these are the centers where there are oxygenated beds. So there are nurses, there are doctors. So these patients can be monitored in the dedicated COVID health center. So the next category is moderate COVID patients, but they have respiratory failure. So they've got pneumonia, but they've got symptoms like fever, cough, and breathlessness, like we said before. But their saturation is between 90 to 94 on room air, or their respiratory rate is more than 24. So they're breathing faster than 24 per minute, or the saturation is below, as we said, so between 90 and 94. So this group of patients need to go to a dedicated COVID hospital. which has an ICU facility, because these patients are at risk of deteriorating further and they might need an intensive care unit or ICU. So what is severe COVID then? So I'm hoping that you wouldn't have to come across these patients because you'll be calling up a stable, uh, sort of mild COVID patients who might become moderate, because you're calling them every 12 to 24 hours. So you might be picking these people as they go from mild to moderate phase, just in case you come across them. Unfortunately, these are people with pneumonia and respiratory failure, but also there is multi-organ involvement. So the infection has gone across their body, the lungs, the kidneys, the brain, the heart, or even their blood pressure and amount of urine they produce might be very low because the COVID infection has spread across the body, or the body's immunity response to COVID has become so uncontrollable that the patient is not coping with the infection or the response to it. So they might have fever, cough, or breathlessness. The saturation will be below 90%. So remember, the moderate COVID with respiratory failure had it between 90 to 94. Here it will be below 90, and the respiratory rate will be above 30 per minute. They might have decreased blood pressure, they might have decreased urine output, that is their normal urine volumes won't be there. So the last three things, that is the respiratory rate, blood pressure, urine output, these are numbers which you won't be able to assess through your phone call. I'm just putting it out there so that you know what the medics are going to be calling out for. So a little bit of extra information for you. In your case, you'll only be looking at saturation, which they can measure using the handheld device at home, as well as temperature. So you wouldn't be having any of the others. So just remember these numbers: below 90 severe, 90 to 94 moderate but with respiratory failure, people who are above 94 but with symptoms of pneumonia, which is cough, fever, and breathing difficulties, they are the moderate who are without respiratory failure. And anyone who doesn't have respiratory symptoms like difficulty in breathing, anyone whose saturation is staying well above 94 and above, and anyone whose heart rate is below 100, these are the safe patients who can continue getting monitored as long as their regular medical conditions like high blood pressure, diabetes, and other things are under control as well. So those are the patients who can stay on at home. So this group of severe COVID patients need to get into an intensive care unit. So they should also be going to a designated COVID hospital, and they should be prioritized to be admitted to the intensive care unit, which should be done by the triage services at the hospital. So just to recap what we were saying, places called COVID care center are places with beds but hardly any oxygen and trained staff to look after the patient. Dedicated COVID health center are places where the beds are there, oxygen facilities there, and there are some nurses and maybe even a few doctors to look after these patients. The dedicated COVID hospital is the higher specialist center where you have doctors, nurses, lots of oxygen, but also intensive care unit beds to make sure that these patients can be looked after even if they become severe COVID. One added point here: if somebody is pregnant 2 weeks before they are due for delivery, so everybody who's pregnant will get a date which says that they are going to be delivering in this week on that day roughly. So 2 weeks before that, a COVID positive pregnant lady should be admitted to a dedicated COVID health center, because during the process of delivery, because there is a lot of effort on the mother's part, she might require some oxygen support, she definitely will require monitoring. So it is safer to avoid home deliveries and make sure that these people are admitted to dedicated COVID health centers with oxygen, etc. Okay. So I'm going to give you some scenarios. The facilitator will be taking you through these scenarios and asking you the question regarding whether the patient is safe for home isolation or not. Now I'm going to hand over to your local facilitator to carry on the training. Thank you so much for listening to the presentation. Soon I'll be joining you again with the next set of presentation, where we'll go into details of what are vital signs and how to monitor somebody safely at home. Thank you so much for listening and your patience, and overall thank you very much for agreeing to volunteer to support our friends, family members, and other citizens in the country during these dire times. Thank you again. Bye.